Hello everyone, my name is Ameer and I will be talking about colonine. Colonine is a brand new drug in making which combines two particular drugs, that being atropine and pralidoxime. These two drugs are typically used to treat cholinergic crisis, an illness on the nervous system where the enzyme acetylcholinesterase that is responsible for degrading acetylcholine, the substance that stimulates a variety of receptors, is inhibited, thus leading to an excess of acetylcholine and an overstimulation of the receptors associated. Colonine, in particular, is designed to treat cholinergic crisis caused by organophosphate poisoning, which is a compound that is typically found in pesticides and nerve agents, such as sarin gas and tabun, which has seen use in recent wars, such as the Gulf War. Colonine is designed as an emergency treatment option for organophosphate poisoning, as these substances can take effect very quickly while the treatment options currently available are delayed. Colonine is classified as an antidotal therapy drug for its use in curing cholinergic crisis. The drug is to be administered through the intramuscular route by using an auto-injector. Now, we will talk about the drug's pharmacodynamics, or the drug's actions on the body. Atropine acts as a reversible competitive antagonist to acetylcholine, and atropine targets the muscarinic receptors, inhibiting acetylcholine's effects at the receptors mentioned. In contrast, pralidoxime removes the organophosphate molecule from the enzyme acetylcholinesterase at both muscarinic and nicotinic receptors. Both drugs target receptors in membranes of cells that are involved in the parasympathetic nervous system. Next, we will look at the drug's pharmacokinetics, or the body's actions on the drug. First, the drug absorption. Colonine is administered through the intramuscular route to avoid the first-pass metabolism in the liver, thus increasing the drug's bioavailability. The simultaneous administration of both atropine and pralidoxime modifies the blood flow, which boosts absorption rate compared to individual administration. Next, drug distribution. Atropine targets the muscarinic receptors in membranes of cells involved in the parasympathetic nervous system around the body. Meanwhile, pralidoxime targets both muscarinic and nicotinic receptors. However, pralidoxime only affects the peripheral nervous system, as the drug cannot cross the blood-brain barrier, which leads to the central nervous system. For drug metabolism, atropine is metabolized by liver into metabolites such as norepinephrine, tropine, and tropic acid. For pralidoxime, the drug is largely untouched, as the drug has minimal hepatic metabolism. As for drug excretion, both drugs are mostly excreted to urine, with a smaller amount excreted by feces. Note that pralidoxime is excreted mostly unchanged, as pralidoxime undergoes minimal metabolism. Now, we will talk about colonine's therapeutic indications, or the medical conditions that colonine is designed to treat. Colonine is used to reverse symptoms induced from overstimulation of muscarinic receptors, such as bradycardia, abnormally slow heart rate, bronchiorrhea, overproduction of pulmonary fluids, or bronchospasm, sudden tightening of muscles in the airways. For the nicotinic receptors, colonine is used to reverse muscle weakness, fasciculation, the involuntary twitching of muscles, and paralysis. Sadly, it's not all sunshine, as this drug comes with a few side effects, ranging from dizziness, nausea and sweating, to urinary retention and fatigue, and in the most severe cases, delirium and coma. However, the more severe symptoms are typically caused by overdosing. Nonetheless, the pros far outweigh the cons, and I believe that choline has a great future ahead in advancing the treatment of cholinergic crisis and perhaps other related illness. And that is the end of this video. Thanks for watching and have a nice day.